You're good, Hannah.
Okay. Hi, everyone. Thank you so much for taking the time out of your day to attend our presentation. We are Sydney, Aaron, Hannah, Cam, and Stephanie, and we will be exploring our program that we created for the CSU OT department that we have titled Social Isolation Identification Program, or SIP. We were assigned to work with the community organization, the Partnership for Age-Friendly Communities, or the PAFC. The PAFC has an amazing vision that's focused on emphasizing a livable community for older adults in Larimer County. The PAFC works towards this vision by creating a positive culture associated with aging, focusing on improving mental, physical, and spiritual well-being, promoting optimal housing options, and improving mobility and access opportunities for older adults. We began our program development process by initiating a needs assessment. The needs assessment process began with data collection through literature review and interviews of community members. We interviewed members of the PAFC, members of other community organizations in Fort Collins, and individuals that we knew that are experiencing social isolation. After data collection and analysis, we narrowed down the main needs for the three groups: the service recipients, which are the socially isolated individuals, the service providers, and the PAFC. For the service recipients, we found that the main needs were safety concerns such as a fall risk, a transportation barrier, and a decline in mental and physical health. For the service providers, we found that one of the needs was connecting with difficult to reach individuals. One of the key informers that we interviewed said finding individuals to participate in the Zoom project is one of our largest barriers. The Zoom project is one of the organizations that's partnered with the PAFC and also one of the potential prospective SIP partner organizations. We also found that there was a technology barrier for the service providers. Lastly, we found the needs for the PAFC to be collaboration and communication, specifically communication between priority groups that make up the PAFC and the self-directed volunteer teams assigned to each priority group.
So next we'll be looking at how the needs impact occupational performance and participation. So being socially isolated can affect any and all occupations that someone engages in on a regular basis, such as ADLs like bathing and dressing, and IADLs like money management or medication management. Social isolation causes mental and physical health risks and has been compared to risks associated with smoking 15 cigarettes per day or having alcohol misuse disorder. Currently, 33% of older adults in Colorado report experiencing social isolation and loneliness. They can have challenges with things like getting out into the community and socializing, so then they become lonely because they're not really connecting with others. If they're not able to engage in meaningful activities that they either want or need to do, that is known as occupational deprivation. So therefore, being socially isolated can have very real and long-term effects on occupational performance and participation and needs to be addressed. Community partners have established a concern with being able to effectively reach and identify individuals who are socially isolated. So in order to address social isolation at the individual level, there needs to be a way of reaching these people and identifying them in the first place.
So we chose to approach this dilemma from a participatory action research framework, which research supports showing promising results for improving complex health and social problems faced by older adults, while also contributing to individual and community capacity building. So we felt that this framework really fit with what we were trying to do in Larimer County and what the PAFC is committed to doing. And then Israel et al. Also lists some fundamental pieces to the PAR framework. Some of them are more important, I think, than others, and why we chose this approach to kind of solve this issue. And those are already building on community strengths and resources that exist already within the community, and addressing health from a positive and ecological perspective. So it's forward-thinking, health promoting ideas about health and community, the community's role in that, and then using pragmatic ways to make that happen. It also facilitates collaborative partnerships in all phases of the research process. So the PAR is unique in that it uses non-academic researchers or community members and their expertise about what's going on in their counties to aid the academic researchers at CSU to come up with the best plan unique to that area. And then finally, it integrates knowledge and action for mutual benefit so that the community grows and in their knowledge and action steps to solving, in this case, social isolation. And then CSU researchers are able to contribute to that, that growth.
So to meet the needs that we've identified, we created the following goal for the SIP program, which is to implement a community-based participatory action research program in partnership with the PAFC to develop and pilot a social isolation identification and referral system in a 1-year period. From our goal, we created 4 program objectives. And the first objective of the SIP program will be completed within the first month. It starts with creating a committee made up of both researchers and community stakeholders as suggested by the PAR framework. The community members can include a community facilitator from the PAFC, any other members from the PAFC that are passionate about combating social isolation, and at least 1 member from each prospective partner organization, such as Circle Talk or Volunteers of America. And then a CSU research professional will also be an integral part of the community, as they'll help facilitate the process development and guide the feasibility assessment. Next, the community members will gather and establish shared programmatic goals and expectations. They'll establish individual member roles and discuss the development of the identification and referral process. And also at this gathering, members from the partner organizations will present information regarding preliminary indicators of social isolation that they've seen in their own experiences. So these may be things like a limited social network, living alone, fall risk, poor mental health, and a lack of participation in meaningful activities. This will help facilitate the discussion surrounding the identification tool development. So the outcome of this objective will be an established committee with shared goals and expectations and a preliminary plan for process development.
The second objective includes the planning and creation of each piece of the program that will be needed in order to pilot it. So the first step includes the social isolation assessment, the data collection and referral systems. There are several short and relevant assessments that are already out there in existence that could be useful for the committee to use, depending on which indicators of social isolation they choose to focus on. And then due to the unique nature of this program, the data collection and referral system can be tailor-made to meet the needs of the program in partnership with the technological resources at CSU. The committee will also choose indicators of feasibility that they want to focus on in advance so that they know what they want to be looking for throughout the pilot process. They also need to develop a plan in order to implement this process, including which partner program involved in the pilot process and other details of providing services that will be important to think through. And then the committee members will decide on what training needs to occur for each partner organization to be able to implement the program during the pilot. Committee members from each partner organization will take what they have gathered from the committee meetings and disseminate it to their individual organizations.
Moving into our third objective, we have a 6-month span of time from the 3rd to 9th month, where we will pilot test the information gathering and sharing process with 5 organizations and then share those results. So these organizations could be the VOA, Meals on Wheels, the Zoom project, and then moving from there, members will perform their designated pilot activities and be trained in how to execute those activities. So that could be once the assessment tool is chosen as a group, how to training in that tool and then how to administer that tool. It could also be their activities could be collecting, analyzing, and storing data. It's just going to be dependent upon what the group chooses for each member. And then the PAFC and the CSU researcher will help monitor those activities and outcomes of the members' activities to determine if any changes need to be made based on the progress reports that those members will then generate for us to be evaluated. Any adjustments that need to be made from that process will be communicated promptly to everybody involved in this program to make sure that everybody's on the same page and there's just really one good concerted effort moving forward to make this SIP program successful. And then at the end of the 6-month period, everybody will sit down and take a look. We'll gather feedback to make a decision about how feasible this program is and how sustainable it will be to choose whether it was successful or not.
The last objective that we created is by the end of month 12 to evaluate the feasibility of SIP and create recommendations for improving future program delivery. Feasibility is important to determine because the higher the feasibility, the more likely our program will be sustainable. The possible aspects to assess for feasibility are the program process, resources, funding, and management. This can be done through a feasibility study or more informal evaluations such as community member and staff interviews. Help establish the program's usefulness and also direct stakeholders in implementing any changes that may be necessary to improve the feasibility and set the program up for future success.
So this is our logic model that we created. And as you can see, it outlines our resources, activities, outputs, outcomes, and the overall impact of the program. Erin is going to talk a little bit more about those resources here in a minute, so we'll skip over those. The activities we outlined in our objectives. And so for our outputs, our main outputs that we're looking at is going to be the social isolation screening measure and the referral system to go along with that, a data management system, implementation of the pilot action plan, and analysis of the program feasibility and the data indicating the program outcomes. Our outcomes hopefully is going to be buy-in from organizations partnered with the PAFC, the assessment administered by the partner organizations, and hopefully we'll get a better idea of the number of socially isolated individuals and can identify them, and then also the number of individuals that are going to be referred to services and programs. The overall impact that we are intending is expansion of this program to additional community partners and improved communication and referral among PAFC partner organizations. Overall, we're really hoping to see a reduction of social isolation in Larimer County and increased awareness of social isolation across all of the organizations.
So in order for this program to function, there will be several resources that will be required. The first is that this program is going to rely heavily on the involvement of the partner organizations. So this will be in terms of the committee involvement, which we estimate probably about 1 hour a week, but that will vary depending on what stage of the program we're at. And then we'll also rely really heavily on the volunteer involvement of individuals from the other partner organizations in order to implement the pilot program. We have budgeted for 4 hours a week for the executive director of the PAFC to kind of help run the program, establish the data management system, all of that. And then 2 hours a week for the CSU researchers' involvement, plus fringe benefits. And then through CSU, they'll be able to access all of the technological resources for developing that data management system and kind of maintaining it over time. Some of the physical materials that this program may require are a computer to run all of the systems, a HIPAA compliant Zoom account in case, as a result of COVID-19, in case the committee meetings need to be held virtually, then all of the information can be handled confidentially. And then office supplies like a printer, paper, pens, all of those kinds of things to be able to have physical copies of the assessment for all of the volunteers to be able to use when they're out seeing individuals in the community. So we have kind of developed a budget related to this program, and there's potential funding possibility through a pilot grant through CCTSI. So this is just kind of an outline of what our ideal budget would look like. We've also budgeted for a 10% contingency because this program is using that PAR model. There may be some variations that occur as the program tends to develop through the process of the involvement of all of the committee members. So this is just an outline of the budget, which would fit nicely into the CCTSI grant. And that is all we had for you guys today, and we welcome any questions or responses that you have to our presentation. Thank you.